Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me at the corner today. And let's see, today I decided I would speak about kind of a bread and butter GYN, and that's yeast infections. Every single day someone comes into the office. I'm not even going to say someone, I'm going to say probably 5 to 6 times a day, a woman comes into the office and she says, oh, I think I have a yeast infection. And now we're doing the virtual visits also. So I also do vaginal infections on the virtual visits. Obviously, I can't do an exam on the virtual visits, but I get their history, what's been going on, for how long, their symptoms, the signs, all of that, to come to a diagnosis. And even on the virtual visits, they say, I think I have a yeast infection. And I think everyone just says yeast infection because that's kind of the only term they know for vaginal infection. But I'm going to say probably only about a third of vaginal infections are yeast infections. So yeast is a specific type of pathogen. It's a fungal, I want to say pathogen. It's a fungal entity that lives in warm, moist environments as opposed to a dry environment. So like a diaper rash is a fungal infection, but it's more similar to a yeast infection. Same as a jock itch is a fungal infection, but it's more similar to a yeast infection because it grows in more of a moist environment. So a vaginal environment is a warm, moist environment. And yeast infections grow in a normal vaginal pH, so they grow in an acidic pH. They actually do not grow well in an alkaline or a high pH. So oftentimes women will tell me that they felt like they had yeast infection and then they got their menstrual cycle and it either went away or it got a little bit better but still there. So that makes more sense because with the menstrual cycle, blood has a high pH. And so the vaginal environment should have a low pH of 4.5 to 5.5, and blood has a high pH of 7 to 7.2 in the vaginal wall. So when you raise the pH like that, yeast does not have a good environment to thrive, so a lot of yeast will die off. And it will either completely clear it up if it was mild or minor or a very early overgrowth of yeast, or it will greatly decrease the symptoms because a lot of it will die off if it was quite a bit of yeast. So some of the main questions I ask when women come in saying that they have a yeast infection, and about a third of the time they're correct, and about 2/3 of the time yeast is a proportion of it, but it's not the whole only issue. So when someone says they feel like they have an infection or they say I have a yeast infection, first thing I ask them is how long it's been going on. And because depending on their symptoms, now regardless of the type of infection you have, if it's been going on for a long time, they will all have similar symptoms because the longer you have an infection, the longer you have an irritant, and the longer your body has to respond to it, and it's going to respond in only one manner. That's going to be an inflammatory manner. So if you say you've had symptoms for 2 days, sometimes people come in, they say, oh, it's been 1 day. It's been 1-2 days, but pretty much 4 to 5 days or less. If you have a lot of symptoms, that's most likely yeast, because yeast is is highly irritant and it has a very quick response from your body with an inflammatory response. Now, if you say it's been going on for a long time, it hasn't been coming and going, it's just been present for a long time and it's slowly gotten worse, it's less likely a yeast infection. So if you say it's been a short amount of time and you have a lot of itching, swelling, burning, stinging, paper cuts, then that's most likely at least a fungal infection, which means it's just an infection on the outside of the vagina, so the vulvar area, not vaginal. But if you combine that with, yes, there's a vaginal discharge and it's thick and chunky or pasty or clumpy or classic cottage cheese. Doesn't matter the color. People put a lot of emphasis on the color, but yeast can have a lot of different colors. I've seen crazy colors for yeast. The most common is going to be white, beige, yellow, off-white. But I've seen gold, brown, green. Green, for whatever reason, is a popular color. Green, and you can tell by my face, is pretty, I'm a gynecologist, I do this all day, but it's still pretty gross when it's green. I don't really know why, just green. Green is actually one of my favorite colors. Green is my favorite color, but not as a vaginal infection. So green or olive looking, I guess because it looks kind of like runny mold. I suppose that's probably why it's kind of gross looking. So I've seen, gold, brown, green, of course pink, because that means it's blood tinged. Those are the most common colors. I've actually seen blue before. I've seen a bluish yeast infection, which is strange, but yeast can have a rainbow of presentation, so the color really doesn't matter. If you tell me it's some strange off color like blue, green, or gold, then I know it's most likely yeast as opposed to other entities. And then yeast should not have a bad odor. Yeast should not have an odor at all. Or if it does, sometimes it will have a pungent odor, a pungent, bitter, almost sour odor, or it'll smell, I've never noticed it, but patients will sometimes tell me it smells like bread. They go, it smells like bread, it smells like yeast or bread. I've never noticed that odor, but that's the report that I get oftentimes. So if someone tells me it smells like bread or smells like yeast, then yeah, it's probably yeast. Or if I notice it's a pungent odor or a strong bitter odor, then it's yeast. If it's a stinky odor, a bad, malodorous tinge, or smells like fish, then it's not yeast. It might have yeast in it, but it's not yeast. So those are the signs and the symptoms. Sometimes some women will have a rash with the yeast infection because it's highly irritant. So they'll have like tiny little bumps, red, tiny little bumps, as I mentioned, along with the swelling, stinging, burning, irritation, paper cuts. Those are very, very common. So if someone says they have pelvic pain, cramping, or they're having urinary issues, that's not going to be from yeast, because yeast cannot ascend into the pelvis. That's going to be from something else potentially going on at the same time, or something else completely different. So true, unrelated. So I'm going to finish right there because I'm trying to keep these presentations under 10 minutes. So this is part one of I have a yeast infection. So the signs and symptoms and the presentation is today. And I'll come back tomorrow. Well, it won't be tomorrow, it'll be the next presentation. I'll come back on the next presentation with how we address it and how we treat yeast infections and the different types of yeast infections. So thank you for joining me. This is Dr. McDaniel at GYN Corner. Please check out the YouTube, the podcast. We're on every single platform for the podcast. So Spotify, Google, everywhere, Apple, all of the podcast platforms. Please hit the like button, the follow button, the subscribe button, and please don't forget to leave comments, questions, and suggestions so I can make sure that I'm tailoring these presentations to your desires, your wants, and your interest. And it's anything across the board related to women and their health. Thanks for joining me again. Have a great rest of your day. Bye.